If you're over the age of 50 and you think, I feel fine, so my blood pressure must be fine, this conversation is especially for you because high blood pressure doesn't usually announce itself with pain or obvious warning signs. It doesn't show up loudly. It settles in quietly, slowly, and for many people, the first real sign appears only after serious damage has already begun. Before we go any further, let me say this clearly and responsibly. Everything I'm sharing today is based on well established medical research and widely accepted doctor recommended guidelines. I always encourage viewers to double check information for themselves, and I'll list trusted medical sources in the video description for transparency and verification. Now, let's talk like two real people having an honest health conversation, not medical jargon, not robotic facts, just clear understanding. After the age of 50, the body starts changing on the inside in ways we can't always feel. Blood vessels naturally lose flexibility. They become stiffer with time, hormones shift, metabolism slows down, stress affects the body more deeply than it did in younger years. All of these changes quietly raise the risk of blood pressure creeping up year after year. High blood pressure, also called hypertension, simply means that the force of blood pushing against your artery walls stays higher than it should be. Imagine water constantly flowing through a pipe at high pressure. Over time, that pressure weakens the pipe from the inside. In the human body, that pipe is your blood vessel system. What makes high blood pressure especially dangerous after 50 is that most people don't feel it happening. You can be living your normal life, walking, eating, sleeping, working, while damage slowly builds inside the heart, brain, kidneys, and blood vessels. One of the most common myths I hear is if my blood pressure were high, I would feel it. That belief alone is the reason so many people get diagnosed late. In reality, most people with high blood pressure feel completely normal for years. As arteries stiffen with age, blood has a harder time flowing smoothly. The heart is forced to pump harder to push blood forward. Over time, this extra workload thickens the heart muscle and weakens its ability to pump efficiently. This is how heart disease quietly develops. Lifestyle accumulation plays a major role after 50 years of high salt foods, limited physical movement, poor sleep habits, emotional stress, weight gain, especially around the abdomen, smoking history, or regular alcohol use all add up. The body becomes less forgiving with age. Hormonal changes matter as well. In women, the drop in estrogen after menopause removes a layer of protection for blood vessels. In men, aging affects blood vessel function and insulin sensitivity. The end result is the same: increased pressure inside the arteries. Now, let's talk about the so-called silent symptoms that people often ignore. Some individuals notice frequent mild headaches, especially in the morning. Others experience dizziness, lightheadedness, or a sense of pressure in the head. Blurred vision or difficulty focusing can appear and disappear. Many people describe a constant feeling of fatigue without knowing why. Shortness of breath while climbing stairs, chest tightness, heart palpitations, or anxiety-like sensations can also be subtle warning signs. These symptoms are often blamed on stress, aging, or lack of sleep. But here's the truth: many people feel absolutely nothing at all. That's what makes high blood pressure so dangerous. You cannot rely on how you feel to judge your blood pressure. When high blood pressure remains uncontrolled, the consequences are serious. It increases the risk of heart attack, stroke, heart failure, kidney disease, vision loss, and memory problems. These complications don't usually appear overnight. They develop quietly over many years and then suddenly change a person's life. High blood pressure often exists alongside other conditions after 50, such as type 2 diabetes, high cholesterol, and obesity. When these conditions combine, the risk to your health multiplies, not just adds. This is why early detection is critical. Every adult over 50 should know their blood pressure numbers regularly, not once, not only when they feel unwell, but consistently. Home blood pressure monitoring can be extremely helpful when done correct. Measurements should be taken while seated, relaxed, with proper cuff placement, and recorded over time. Single readings don't tell the full story. Let's talk about what actually drives blood pressure up. Excess salt intake is one of the biggest contributors. Many people believe they don't eat much salt because they don't add it at the table, but hidden sodium is everywhere. Packaged foods, sauces, breads, restaurant meals, and processed snacks. Physical inactivity weakens blood vessel flexibility. As movement decreases, circulation becomes less efficient. Chronic stress keeps stress hormones elevated, which directly raise blood pressure. Poor sleep disrupts the body's natural regulation systems. Weight gain, particularly around the midsection, increases resistance inside blood vessels. Alcohol and smoking have stronger effects with age because the body processes toxins more slowly. Now for the good news, high blood pressure is manageable. Lifestyle changes can significantly lower blood pressure, reducing salt intake, eating more fruits, vegetables, and whole foods, walking daily, managing stress, improving sleep quality. Even modest changes can produce meaningful results. For many people, medication is also necessary, and that is not failure. Blood pressure medication is protection. It protects your heart, your brain, your kidneys, and your independence as you age. What matters most is taking medication consistently and under medical guidance. Never stop or adjust blood pressure medication on your own. Doing so can be dangerous. Seek immediate medical care if blood pressure readings stay very high or if symptoms like chest pain, severe headache, sudden vision problems, weakness on one side of the body, or difficulty speaking occur after 50. Ignoring high blood pressure is not a harmless decision, but taking control is empowering. You are not powerless. Knowledge truly is protection. If you haven't checked your blood pressure recently, make it a priority. And if this video helped you understand your health better, please like, subscribe, and share it with someone you care about. Your health matters, your future matters, and it is never too late to take control of your well-being.